And welcome to Broadband Breakfast Live Online. My name is Drew Clark. I'm the editor and publisher of Broadband Breakfast. Happy to welcome you to another session of our weekly webcast. Today, we're concluding a series we've been having on smart cities, broadband and smart cities. And the focus of today's BBLO, as we call it, is healthcare and smart cities. And we are excited to welcome an awesome panel of experts in healthcare and maybe healthcare and technology. Can't say for sure it'll be healthcare and broadband, but it will be definitely healthcare and how higher capacity internet can help improve outcomes in the cities of the future. Right. This series we've been doing on healthcare, or I should say, a series on smart cities that we've been doing. We've covered topics including education, transportation, multiple dwelling units, issues of digital inclusion, transportation. These are among the topics that have been part of this series that we've done over just shy of 2 months now, and excited to conclude it out. I also want to call everyone's attention, if you're not familiar or this is your first time joining Broadband Breakfast Live Online, we are a news and events community focused around better broadband, better lives. So that means that we report on every day, we report on the broadband build out taking place in the United States, and the impact that it has on people's lives. So we kind of take that seriously, where we do want to talk about the fiber and the wireless and the capacity questions, but we're also equally interested in the impacts on people. And healthcare, of course, is one of those key topics that we care about. And I should also say that we are very excited to announce our upcoming in-person event. We just came off of a little bit shy of a month ago, the California Broadband Summit that we did in collaboration with Cal Matters in Sacramento. It was our first out of Washington event. We had 330 people there. It was very, and many more online. This event, this Broadband Breakfast Live Online, we do every week. Obviously, it's online only, kind of welcoming people from all over the country and the world. And on September 19th, we're doing our 6th annual Digital Infrastructure Investment Summit. And tickets are available now. Just go to broadbandbreakfast.com and click on Digital Infrastructure at the top to sign up for that conference. And I also want to give a shout out and a thanks to the sponsors of Broadband Breakfast. We would not be able to do the programming that we do every week without the support of these sponsors. They include Utopia Fiber, Comcast, SmartWave Technologies, Ookla, Wesco, Hoos Systems, the Institute for Local Self-Reliance's Community Broadband Networks Initiative, the California Emerging Technology Fund, Google Fiber, Broadband Now, NCTA, the Internet and Television Association, WISPA, Broadband Without Boundaries, and Tirana Wireless. If you are interested in sponsorship options, feel free to email us, sales@breakfast.media, or you can always just email me, drew@breakfast.media. Let's go ahead and open it up to our 4 panelists. You can go ahead and turn your cameras on, everyone. Thank you so much for being with us here. I'm going to go ahead and introduce each of our 3 panelists. Unfortunately, one who had committed had a last-minute medical emergency, I believe. So she is not able to join us. But we will be hearing first from Julia Skapik. I hope I got your name right there, Julia. Thank you so much for being with us. She is the Chief Medical Information Officer at the National Association of Community Health Centers. And as such, she's a board-certified internist and clinical informaticist. And at NACHC, she heads the development of technology-enabled public health and quality improvements, next generation health information technology data infrastructure and warehouse, and a unified data dictionary for community health, along with a curriculum for informatics and human-centered design. And she's also an industry leader as the board chair-elect of Health Level 7 International. So super excited to hear from you, Julia, and glad you can be with us. We'll turn to you just now to give your thoughts on healthcare and smart cities. Julia will be followed by Catherine Pugh. She is the Director of Digital Health at the Consumer Technology Association. We actually had Catherine's colleague, India Herdman of CTA, at another Smart Cities event on smart cities and transportation. So we're happy to have our second CTA representative. Catherine, thank you for being with us. And before joining CTA, Catherine served as the Assistant Vice President of Policy for Executives for Health Information. That's EHI, Executives for Health Information. And Catherine also served as Senior Director, Government Affairs at Horizon Government Affairs, where she managed the Health Innovation Alliance. And she began her career at the Parkinson's Action Network, which is now part of the Michael J. Fox Foundation for Parkinson's Research. And there she managed federal policy initiatives and advocacy strategies. Thank you so much for being with us, Catherine. And then our concluding panelist will be Paul Villa. Paul is the Director of Technology, which is a volunteer position at Champions Community Foundation, CCF, which is an Atlanta-based charity with a mission of empowering physically challenged young adults to reach their full potential. And he's previously worked with Georgia Tech, Google, SmartWave, and others to design and implement technical infrastructure for assistive technology for Champions Place. And he's also directing the transference of this assistive technology used at Champions Place into individual homes of physically challenged young adults in Atlanta. So thanks so much, each of you. So let's turn it over to Julia to give your thoughts on the topic, and then we'll kind of go to Catherine and Paul, and then sort of a more general Q&A. So the floor is yours, Julia.
Sure. Thanks so much for having me. As mentioned, I'm the CMIO of the National Association for Community Health Centers. So we represent the 1,487 individual nonprofit healthcare organizations in the U.S. that provide basically the outpatient comprehensive healthcare safety net in the United States. So some of those are huge health centers in big urban areas, and some of those are very small health centers that work off of, say, the bush in Alaska or remote islands in Maine, or areas out in the middle of the desert in Arizona and places like Wyoming and Oklahoma. But all community health centers share the same mission, which is to provide healthcare to their communities, regardless of a patient's ability to pay or access to health insurance, to meet their needs in a way that's patient and culturally centered and competent, and to provide those services in a comprehensive way, which actually includes not just things like traditional primary care, but also things like dental care and optometry care and essential services, which are social needs, social services that meet unmet social needs. So things like transportation services, and many health centers actually do have virtual health programs and educational programs that include things like providing access to devices so people can get online and access their health information and telehealth. NAC as an organization actually works with a number of federal agencies and foundations to help further access to broadband. In health information technology, we see that there is a great opportunity for us to use technology, obviously connected by high-speed broadband, to improve health and reduce health disparities. But the real risk remains that actually with health information technology, if applied differentially, as many things in our healthcare system are, we could actually make health disparities worse. If we drive things like access, depending on things like access to broadband, access to smart devices, we actually may make our access challenges worse and leave populations out of that sort of revolution in innovation and use of technology to improve healthcare. NAC also works with health centers at the organization and facility and infrastructure level. So some of the work we've been doing recently is around environmental and climate health. NAC has done a program where they've assisted health centers in areas that are prone to disasters and power outages to install solar so that the community health center can become an access point for people in the midst of an emergency where, say, air conditioning, power to charge phones, internet services, or cellular services may be disrupted, to have the community be able to access those services at the health center because they have a robust solar grid. We're also looking at how we can encourage the federal government to continue to expand those programs that provide high-speed internet to people who are low income. As many of you know, that program has been under threat many times, and we know that many health center patients are the very same people who access the low-income broadband program, and so that's a big priority for us. And of course, maintaining and improving connectivity in rural areas is key. During the COVID pandemic, when healthcare organizations sort of closed their doors around the country, many people at urban areas with good device and connectivity and knowledge easily sort of switched over to telehealth. But in many places where connectivity was not good, patients found in rural areas couldn't access the services the same way that people could who already had better means of better access. So those are all priorities for NAC, and we really want to see technology and connectivity to be a bridge that reduces that digital divide and reduces those health disparities, but without a concerted effort to really raise those equity and justice issues and ensure that there are investments into them, we are at risk for making that a new source of disparities, but not a way to close them.
Thank you very much, Julia, and thank you for giving us that that lay of the land as you see it. Let's turn now to Catherine. Go ahead and give us your thoughts on this topic.
Thanks, Drew, and thank you for having me this afternoon, and thanks to everybody who joined on a holiday week. So the Consumer Technology Association, if you do not know, we are the trade association for the consumer technology industry, and we have more than 1,300 members across all of our member divisions. As you mentioned, I sit in our Government and Legal Affairs Department, but I work closely with our Health Division in my work. Most people will recognize and know CTA because we are the owners and operators of CES, the Consumer Electronics Show, the most powerful trade show, technology trade show in the world. So I just wanted to start off actually by talking a little bit about CES and some of the smart city trends that we saw this year in January in Las Vegas in the smart city space. So outside of the health space, some of the larger topics and trends we saw at CES were around electronic vehicle chargers, innovations in waste management and sustainability. We had actually one exhibitor who won one of our innovation awards this year, showcased how LiDAR could be used to detect when crowd density rises to unsafe levels. So those are just really cool things. It sounds like there was other webinars that touched on those topics, but in health at CES, we continue to see a growth of home sensors. So this is everything from AI-powered intelligent pillows and mattresses to track sleep health, toilet monitors that can help people better understand their health and diet. And that I think is really cool, and we'll continue to see innovations in this space in January 2025. CES is also really proud to showcase many innovations that provide accessible solutions in the home for technology around like accessible gaming, but more so on the health space. Exhibitors that are using technology to build attachments to make appliances more accessible for people with visual and dexterity impairments. So switching over to the CTA side, our trade association work, the rest of the 360 days of the year, we are supporting our members, CTA is supporting our members in addressing issues that are raised in the webinar description, like security and privacy. On the privacy front, I will say CTA does support a national privacy law. In the meantime, we're taking steps like the Health Division convened our members to develop guiding principles for the privacy of health data. That's been updated every year to provide guidance to industry about best practices for protecting the privacy of health data. And I will say that is for data that is outside of the HIPAA protected space, so outside of data that's held by healthcare providers or business associates of healthcare providers, which are the main devices we're talking about here when we talk about health and smart cities. CTA is also an ANSI accredited standards development organization, and we are about to publish our 30th and 31st digital health standard. One of those standards is actually guiding principles for practice and transparency for mobile health solutions. And we're also have ongoing standards works driving standards around the increase of FDA cleared over-the-counter health devices. So this, if you think about this year, FDA authorized the first over-the-counter continuous glucose monitor and over-the-counter pulse oximeter. So these are devices that are used outside of the healthcare setting to help people better manage their health in the home. CTA standards development work has also been a large part of our work on the FCC's Cyber Trust Mark program. So this is getting more to the security side of what we've talked about. And so as we see the increase in consumer connected devices or IoT devices, we also recognize that there is a need for security and for consumers to be educated on the devices that they are buying and putting in their homes. So CTA worked with NIST and others for more than 5 years to develop a voluntary national cybersecurity program for consumer connected devices, or the FCC's Cyber Trust Mark program. And we're now focused on ensuring a robust consumer education campaign with active government involvement, promoting international alignment, and through CTA standards committees, developing recommendations for operational details, such as the label design of the trust mark. On the infrastructure side, getting to the broadband of it all, CTA supports increased commercial access to licensed and unlicensed spectrum and supports efforts to renew the FCC spectrum auction authority. We do advocate for an all-of-the-above approach to spectrum policy, which recognizes the benefits of low, mid, and high band frequencies through licensed, unlicensed, and shared use. So that's kind of just the overview of CTA's work in this area, but happy to kind of dig in more on the question and answer around the impacts.
Absolutely.
On health space.
Yeah, no, thank you. Got a number of questions spurred by that, and we've already got a number of questions from our audience. So thank you very much. So Paul, if you would just make sure your camera's on, the floor is yours to give us your thoughts on this topic here.
Terrific. And thank you very much for giving me the opportunity to talk about Champions Community Foundation. And thank you for those people that are joining. So I'm going to restate the mission statement that you said earlier, Drew, which was the mission statement is Champions Community Foundation exists to empower young adults with physical disabilities to reach their potential for independence and belonging. Well, what does that mean? That means that we are fighting isolation and loneliness in physically challenged young adults and its effect on the mental health of both them and their parents as caregivers. So we do this through 4 initiatives. But before I get into those, let me tell you a little bit more about this community we serve. So the physical disabilities are caused by cerebral palsy, spina bifida, muscular dystrophy, physical injury. But these young adults, I want to call them kids because I'm old enough I can call them kids. They are funny, intelligent, hilarious, desire to be independent is truly amazing in this group. In the Atlanta area, we had a study done for us, and it told us that there are about 11,000 of these individuals in the Atlanta area, and nationally, the estimate is around 630,000. Now, each year, when these kids were going to high school, there were events for them. They, were engaged for 8 hours a day. They had friends that were similar to their issues they had. And, they could study. But after they graduated at 21, because the students could stay until 21, they got home and all they had was a TV set. Isolated, alone, lost contact with their friends, lost contact with all the socialization. So in 2009, 6 dads got together and thought about this problem. They all had children in this situation and said, we have to do something. And they created the first initiative, which was the Titan Community Program. And that is it's a broad range of athletic and social programs that they do. For example, 2 times a month, the Titans get together for a scrimmage. They have a local gymnasium at a church. And these kids come in rolling in their wheelchairs. They switch over to sport wheelchairs and they laugh, they talk, they meet, they engage, loud music playing, and they compete. Parents are often, for some of them, will be pushing the children or the young adults through the process. It's sort of like a wheelchair soccer program kind of thing like that. But it's wonderful. So as time went on, it became, medical science is a wonderful thing. And so what the parents were finding is that their children were living longer. Unfortunately, medical science was not helping the parents to live longer. In fact, they were finding themselves aging. And the real possibility that your child who is physically challenged could actually outlive you, it became a real concern, because where are they going to go? At this point, a nursing home. And I'm not saying anything bad about nursing homes. They're amazing places. But I think we can all agree it's not a place for a 21-year-old or a 32-year-old to live the rest of their life. So in 2014, Champions Community Foundation broadened their focus by pursuing something called Champions Place, which is a uniquely designed, safe, accessible, affordable, shared living environment. It is a physical building that these individuals can come and live. They're like apartments. Now, this is not a hospital, anything like that. I mean, it is a place that is designed to, that has the needs and the caregiving structure for physically challenged young adults. Now, here they live independent and productive lives. They work. They actually, Home Depot will have a greeter, Starbucks. They'll work in hospitals where they will take prescriptions or flowers from floor to floor. So they're working. They're volunteering, where they either are doing fundraising for other charity organizations, or they're going into the high schools to bring awareness to what it's like to be physically challenged. And they're living there. And I remember the very first day that that the kids went out to work, and then they came back, and the first one through the door had been off the bus into the place. He raised his hands up into the air and yelled, "I'm home." And it was a great thing to watch him say that. So as far as we know, this is the first and only place like this in the nation. We haven't found any. We keep looking. We share all our information. We've been contacted by perhaps a half dozen other cities, areas where we want to share as much of the information. But in addition to being a residential facility, it is also a social hub where we have a large meeting room, we have a beautiful outdoor, and it allows the Titan community to come there and, again, help reduce that isolation. So the Champions Place itself helps with the isolation, but also independence, because what 30-year-old wants to still be living at home with mom and dad? Just because you're physically challenged, it doesn't change the same desire that you're a 20 or 30-year-old and you don't want to live with mom and dad. And so it gives them that opportunity to do that. Now, in addition to that, we wanted our place to be a model for assistive technology. We wanted to do everything that we could. So from the very beginning, we worked with, went to Georgia Tech and looked at their Tools for Life program, very enlightening. And we took that and we ran with it and expanded it for our this residential facility. SmartWave was an unbelievable, and still is, a fantastic partner, helping us design the Wi-Fi structure and connectivity to broadband that we needed so desperately, because we can't do this assistive job without that. Google has been a great partner as well, providing not only funding, but also equipment that we use. So we have a place that the kids are automated doors where it has the intelligence. If they're wearing a badge, they know what door can open. It opens as they approach. Controlling lights, fans, shades, TV, music, being able to change channels, all allowing independence. Now, so there's only so many people we can have in this building. So the idea is our next initiative, which is called Champions Place at Home. We want to take this and have been taking it into the Atlanta community. So what this means is at no cost to the family at all, we go ahead and sort of qualify people to understand exactly, that we can help them. And when we do, we'll show up at their house, we confirm their Wi-Fi, we automate their lights, fans, TVs, radio, music. Kids can make phone calls now off of the Google devices. And this has obviously a lot of benefits. Again, for those people at home, it helps reduce the isolation. They can call their friends. They can also help their independence because they're able to turn on and do all these things they've never been able to do before. The parents' benefit is now they can actually go out for a date and knowing their child can reach them. They haven't been able to do that before other than maybe 15 minutes. Now they can go out for a few hours and feel confident. So the impact on mental health for both the parent and the child is amazing. So I've been given a gift in being able to work with Champions Place, and that is in going into these homes and watching a 30-year-old for the first time in their life be able to turn on a light switch, being able to have a fan turn on in the middle of the night, change a radio station, change a TV. It is humbling for me to watch that, and it's such a joy. The impact and the gratefulness and the life-changing that IoT and broadband brings to this group is amazing. One simple little thing, for example, that we have just turning the fan on, the ceiling fan. Moms and dads tell us all the time that is so impactful because now they don't have to get up in the middle of the night and come down and turn the fan on or off because the child couldn't do it themselves. So a great impact. All right, last initiative, almost done, and it's called Champions Community Connect. We call it the 3C. And this, again, is to continue to work on fighting isolation. So Champions Community Foundation has created a virtual world where 6 nights a week for an hour, there is a community that comes together of all these to be able to, they have a trivia night on one of the nights. They might watch a sporting event. They have topics. They'll have guest speakers will come and talk or be on live. Without broadband, it's just not possible. And again, they meet, they connect, they have friends, and it's just wonderful. And for that 1 hour, we had a parent tell us, it's like, when I know that Susie goes into the room to spend that hour, I can go out for an hour, which is great. So that is about Champions Place and the 4 initiatives that we have. And again, the importance of Wi-Fi and broadband cannot be understated. We could not do what we do without that technology.
Wonderful. Thank you so much for this incredible story and for the obviously I imagine many personal engagements that led to it. I want to dive right into the questions we've got from the audience. I've got some too, but we've got some really good ones here. This one from Dan Smith. He asks, in Hawaii, the 3 big healthcare systems all share data in Epic/MyChart, but the community health centers are not in MyChart solutions. So this may be getting into some of that healthcare lingo. So maybe Catherine and Julia and Paul, you can speak to this. Could you speak to what MyChart is and the sharing of health data? And I'm not so focusing on the privacy end so much, but like literally, as Dan's asking, how do we make sure everyone's included in the appropriate sharing of healthcare data?
Sure. So I can take a start with that. Yeah. So MyChart is a QHIN, a qualified health information network. It's designated by the Office of the National Coordinator for Health IT, who's our regulatory body for health information technology. And a QHIN is basically like an HIE, a health information exchange. The unique thing about Care Everywhere as a QHIN is it's actually sponsored by the vendor, Epic. So if you're an Epic customer, you can easily access Care Everywhere. And if you're not an Epic customer, it's much harder to sort of link that information into the network. The idea of QHINs is that QHINs can cover a broad range of different types of organization, different vendor products, different regions, and that if linked to each other, eventually we would have some sort of functioning national health information exchange where networks of organizations link to other networks. And so information eventually flows sort of everywhere it needs to go for every user, if you will. Community health centers also have similar kinds of organizations called health-centered controlled networks. Sometimes those are based on a vendor product, sometimes they're based on a region, sometimes they share a population health tool. They can function sort of like an HIE, but they often more function as a population health entity. At NAC, we've worked really hard to try and raise awareness of folks about QHINs. However, the technical capacity and staffing to support some of these kind of interoperability projects can be very challenging for health centers. Their budget is usually about a quarter of what the budget of a traditional outpatient healthcare organization would be providing similar care. And so it's really challenging for them to find the staff and also to hire and retain the staff, given their budget, that can do this work. And it's our goal to leverage the FHIR, Fast Healthcare Interoperability Resources API standard that was put out by ONC at the end of 2022 to use the vendor APIs to help to enable this kind of exchange without having to build a bunch of pipelines at the health center level. If the person who put this question in the Q&A would like to contact me, I would love to talk more about working with the PhDs in Hawaii to enable that as well. So I'll put my email in the chat, and anyone who's on the call is welcome to send me a message about any.
Awesome. Thank you very much. Is this something that you've worked with, Catherine and Paul, or shall we move on to the next question?
I have not at CTA, but in a previous life, I think Julia just really hit everything that I was going to touch on, and I was definitely going to defer to her as the, I think, incoming president of HL7. So I think standards, but I will say, even though CTA doesn't work on the standards for data exchange like HL7 does, we do really recognize the importance of standards in interoperability and sharing the data, because I did work on the legislation that enabled the trusted exchange framework that Julia is talking about. And the impetus behind that, and that was provisions in the 21st Century Cures Act, was ensuring that exactly what you talked about, is that data can be shared, health data can be shared regardless of what EHR vendor that a health system chooses. That should flow across systems regardless of what system that a health center or a hospital chooses to use, and that patients should have access to that data. And so that kind of sets the legal underpinning for what Julia standards is helping actualize.
And I can't resist asking, what is health level 7? Okay, because you've referenced this and it's in your bio. And I should point out, Julia, you're Dr. Skapik, so you're a doctor. So could you just speak to what is health level 7 and why should we care about what health level 7 is?
Sure. So Health Level 7 is an ANSI certified or ANSI accredited international standards development organization. And in the HL7 community, people work in consensus, and they come from all sorts of different backgrounds. So they're people who still do clinical care, people from nursing and pharmacy, but also we have a lot of representatives from electronic health record vendors. We have a payer community, and we have a bunch of technical experts like terminologists and researchers. So basically, those people come together and say, what's the right way for us to encode information, protect information, and share information so that we can create an interoperable environment that allows all of these use cases to go forward: research, patient care, post-acute care, payer, provider partnerships, and value-based care arrangements, et cetera, et cetera. So HL7 is probably the United States sort of premier standards development organization for health IT. And we work closely with the Office of the National Coordinator for Health IT, who, as I mentioned, is a regulatory body in this space. And HL7 will use the consensus process to build the content and transport and other privacy and security requirements of standards. And then the federal government can choose, and it's not just ONC, it's also organizations like CMS and CDC, to reference those requirements in their own programs or policies. And so when I mentioned FHIR API, a specific version of the FHIR standard is referenced, and the expectation is that there's a content standard in ONC called USCDI, US Core Data for Interoperability. And that is supposed to be transported using the FHIR standard through an API that's protected by a OAuth 2, a security standard. But anyone is welcome to join and participate in HL7. You can join as a member, but there's actually no cost to participate. And almost all of our work groups meet virtually. So please look that up. We have a work group plus meeting in September, which is a great way to get to know the organization and hear from some of the agencies and stakeholders about how this work is impacting them.
Okay. Let's shift to another but very interesting topic. This is from Jim Mercanti. He asks for the panel's insight and opinions on the prevalence of smartphones as the ubiquitous device for seniors and low-income citizens, and how this impacts telehealth for these populations. And then he points out that particularly given that many of the NTIA's covered populations can only afford one device, that tends to be the smartphone. Let's speak just a little bit about smartphones and how they play a role in digital health or mobile health. I mean, like both as a kind of a means for broadband, but also, you know, some of the apps that are enabled by a device that you carry with you almost all the time. Who'd like to tackle that one first? Go ahead, Paul.
Sure. So in our world, the phone is absolutely essential to what we do and being able to have access, because all of our products actually run off of apps. And that's one of the requirements we have. You have to have a smartphone, you have to have an iPad or a tablet of some type. So, I mean, I just think it's absolutely incredible that we have this device that can be so powerful, as we all know. It has pluses and minuses, but in our particular, what we do, it is essential to being able to give this independence to these individuals.
Catherine?
Yeah, I'll just, I completely agree with everything that Paul said. I will add to that is not only do smartphones help enable connections in the telehealth side, which was mentioned in the chat, and the availability and adoption of smartphones is very high across the board, higher than computers in the home. Almost everybody has a smartphone. With that being said, we're also seeing a large number of what is called software as a service being developed. And so that could include everything from AI to healthcare apps on your smartphone. So what the best example of software as a service is probably what are called digital therapeutics. And those are software apps that you can download on your smartphone. And developers have taken, for example, a common mental health intervention, cognitive behavioral therapy, and built that as an app where, because we have such a healthcare workforce shortage, especially in the mental health space, that a provider can, instead of saying, you have to come back and see me every single week for this very, structured program that we have to do over X amount of days, they can say, why don't you use this FDA clinically validated app instead and do it in the comfort of your home? So you go through the same program virtually on your smartphone. And again, FDA approved, cleared application, software as a service, or software as a medical device is also called that. And so smartphones at that point are also very critical to access care, because you're not only can they help you via telehealth and a real audio visual real-time connection with your provider, it also can be used as a clinically validated app that can help people with their mental health issues, or even going through like cardio rehab or physical rehabilitation after surgery. So I think I just wanted to add that because smartphones are essential for telehealth, but it's becoming a larger part of overall healthcare, not just the real-time audiovisual connection.
Well, let me also just ask, though, because, given just a few weeks ago, the Surgeon General raised kind of the pitfalls of social media. Now, again, social media and smartphones are not necessarily the same thing, but there's a lot in which, particularly for teens and young people, there's a concern that social media, so maybe this is the flip side of the positives of smartphones, right? And so again, let's just hear from each of you on how real is this concern about social media for teens or just for adults, right? What are the mental health concerns? Are there mental health concerns that can be raised by overconsumption of social media?
So if I could jump on the end of the last question and then sort of segue into the current one. I think one of the great opportunities for smartphones is for patients to really document and track longitudinally the conditions that they have chronically, right? Because in healthcare, we have a tendency to have these brief encounters. And so we get these little snippets of information at points of time. Whereas the patients with their phone, everywhere they go, there's information that's physiologic. There's information about, how they spend their time and where they go and what they're experiencing. And that information can be very valuable for trying to, say, tease out a very complex or difficult diagnosis or understand whether or not a pain or symptom treatment regimen is really working or not. Asking 6 weeks later, is it better or worse, is much less effective than it being able to see sort of what's the trend and what's the day-to-day experience. The same thing, of course, is true of blood pressure. If you get one blood pressure reading in the office versus looking at that over time when the patient's at home and not in a healthcare setting. Another opportunity is patient-generated health data. So the more information the patient generates themselves, the more likely that information is to be accurate and valid. And also, if that's transmitted, the less information that I retype into the EHR or someone from the team types into the EHR. So there's really also a valuable component of reducing the data entry burden on care teams so they can focus on providing care. I will say that community health center and health equity populations are the least likely generally to have access to smartphones. And research shows that if we're doing health communications using phone technology, actually text messaging is more effective, probably partly because it's asynchronous, doesn't create a lot of reminders or use a bunch of data. But in terms of being able to sort of remind patients of things, ask them questions and give them information, for example, there's a heat emergency in your area today. Here's how you find a cooling center can be a useful piece of information the patient can go and reference later. In regards to social media, so one of the first things I want to say about technology that's not related to healthcare, that's not in a covered entity, does not have the same privacy and security protections as information that's subject to HIPAA, which is the federal rule about privacy and security. So one of my big concerns about social media and other technology platforms is whether or not they are considering and attending to and protecting the privacy and security of that information when it comes to the patient. I think it becomes even more complex when we look at sort of mental health and the effects of long-term screen use, especially in patients who already have behavioral health issues and patients who are developmentally sort of not ready for that kind of exposure. And I think, some of you may have heard about the proposed new ban in New York City on cell phones in schools. And I think the research on those outcomes is really sort of nascent and not complete. And so it's hard for us to sort of argue for the need to limit these things despite known risks because we don't have that complete data. But I think, the evidence is emerging. And I think the early evidence shows that we should take caution. We consider sort of unfettered use of technology, especially in brains that are not fully developed.
Thank you. Do either of you want to also weigh in on this question? I want to bring a kind of maybe a twist here, and this is building off of two questions. One by Ron Suarez here about does investing in community internet offer return on investment related to savings from telehealth? And maybe a kind of a similar question from Dan Smith: should healthcare organizations be willing to subsidize computers, and we might say broadband, for low-income patients? And this is actually something in the broadband world I have heard a lot of talk about. Just, you know, the scope and scale of the healthcare industry is enormous. I mean, even though the broadband industry is big, it's nothing compared to the healthcare industry. And so if we're looking at savings to be had from integration of broadband, that seems to be a real winner. And I would, again, love all the panelists' thoughts on community or public investment in broadband and internet as a way of improving health outcomes. Paul, do you have any thoughts on that? Oh, Catherine, go ahead.
No, Paul, go ahead, Paul.
Well, I think there's no question. You know, we have in the Atlanta area where it's particularly where we are, it's a very affluent area, and they have access to that. We can't. Broadband has to be available for everybody. And, you know, I would even envision, you know, if our initiative continued to grow, we currently provide all the devices, we might even possibly look at somehow providing subsidies for some families as we start to reach outside the metro Atlanta area needing this. But it's you just have to have it. It's like having water. It's like having sewage. It's broadband is an absolute necessity. I think that's all I got.
Catherine.
Yeah, while CTI doesn't weigh in from a policy level around federal funding in this space, you know, I think that the access to broadband is certainly important in the health space, as it was mentioned earlier. You know, I would say the one kind of hiccup in this is that healthcare organizations and healthcare providers, they have to have a way to get reimbursed for these services. In the healthcare space, the doctors and providers, they bill for providing services. And you can, from a Medicare perspective, there's some leniency on the Medicaid side and commercial payers, but from the Medicare perspective, which is, you know, the over 65 and those who are on Social Security disability, you can't bill for providing broadband for someone. You can only provide bill for providing medical services. So it can be tough with what they are able to do. But, you know, I think, and maybe Julia can weigh in on this too, I think health centers have some great programs in providing devices for patients that they're able to provide via Medicaid or state grant funding. I think those are great avenues for health centers that are looking to provide those services, and perhaps depending on how your state is deploying their infrastructure money as well, that might be additional ways to look at how you can provide devices for patients in their homes and even help with their broadband costs.
Okay. We got some other, oh, Julia, please go ahead.
Yeah, I'll just quickly say, yeah, I strongly agree with that. Many health centers use grant dollars for these kinds of programs, which means that when the grant money runs out, the program ends. And so we need a sustainable approach to this. We've done also work on digital health literacy training for patients. And I think that there may be sort of an emerging avenue that CMS created of billing for community health worker time, but there are still a bunch of constraints on what that work can cover and whether or not it has to be linked to a billable provider encounter. So that's definitely an area where more advocacy is needed.
There is a group of people who have been advocating and raising concerns about wireless radiation. And one of those people is active in our chat. Obviously, this is an issue that tends to be, kind of glossed over. There has been extensive evidence that there is not electromagnetic radiation that's harmful. But at the same time, we are using wireless more. So I do want to just give the three of you an opportunity. Do you have any thoughts on this question that's asked about concern about wireless radiation from a health perspective? Any of you have any thoughts on that?
No thoughts. I would just say I tend to agree, Drew. You mentioned with the evidence that's been developed so far. And so far, I haven't seen any strong evidence that there is any concern around wireless radiation.
Thank you. We got a question as well from about devices and ecosystems, right? In particular, Apple. So I think Ron Suarez has asked about Apple's closed garden sometimes make iPhones less compatible than Androids. And I'd actually like to kind of talk about the watch, right? The Apple Watch, because I don't think a decade or so ago when they launched, I don't think they necessarily thought of it as a health device, but that's very much what the Apple Watch has become. And I'm just wondering, do any of the three of you have thoughts on sort of the closed kind of garden approach that Apple's sort of known for versus, the standards? I mean, is a closed garden approach on watches or smartphones going to be less helpful from a standards perspective, or can kind of proprietary technologies coexist? Or I guess I should say, how can proprietary technologies coexist with the standards-based approach that Catherine and Julia spoke about earlier in this webcast? Anyone want to speak to that?
I'm not going to speak to any, specific development method, but would just reiterate again that standards are an important piece of this process. I think almost all of the companies mentioned participate in standards development in some level, I'm sure, and consensus-based approach like Julia outlined earlier, for specific health applications, whether that's on the watch or on your smartphone, that do make a direct medical intervention or a medical claim that goes through the FDA process. So a lot of those times there is a lot of proprietary information anyway, and they're putting a lot of resources into not only developing those processes, but then going through the extra step of getting FDA approval or authorization for those specific software functions. So it is a great investment outside of just, being able to send a text back and forth, which is what I kind of try to address in the chat I sent here, is that in the healthcare space, for most use cases, you're not just texting your doctor a photo. I mean, you might, depending on how your doctor operates, but you're using specifically developed apps that might run on an Apple or Android, but are not very specific. And so a lot of those apps that are developed have solutions for how you can upload photos and videos.
Okay.
Yeah, and I'll say in general, I think it's really important for us to have open source standards, but also for us to consider about access to platforms that are, particularly those that are ubiquitous. We know that it definitely stifles innovation when the owners of platforms and technologies limit who can and can't participate in the marketplace and create high bars and costs to entry. And we see that in the electronic health record marketplaces sometimes. Someone builds something that they want to give away for free, but the vendor wants to charge for access to that, even if it's for a public health good, for example. So many of these challenges sort of remain to be solved. There's certainly a role for the federal government to be involved. I'll say when it comes to the testing and regulation and security of all health IT tools, for the most part, there are significant deficiencies, and hopefully over time, there'll be substantial investments in both the private and the public sector in figuring out how to address those deficiencies and close those gaps without necessarily creating too many bars to entry or removing products from the marketplace that genuinely add value without introducing too much risk.
want to give each of you an opportunity to close out, but before I do, I want to ask sort of maybe just two separate questions about privacy and anything else that we should talk about on privacy. I mean, in some ways, everyone knows health records are sensitive, and so that's kind of a given. The question is whether there's overkill on privacy, and so there can't be the kind of sharing that's useful. But Jim Mercanti also asked a good question about states and local governments having a healthcare digital office and strategy. And so I'm wondering if either of the three of you are seeing local government strategies on digital healthcare. So ask those questions before we do a round with closing thoughts. Catherine, do you have any thoughts on the privacy question? Is privacy, I mean, like you said at the beginning, you support a national privacy bill, and you know, there seems to be a lot of agreement on that, but who knows why it isn't happening, right? But short of that, what are there privacy obstacles to better digital health applications?
Definitely. I think Julia mentioned earlier, there is a very strong health privacy law, HIPAA, and that applies to the privacy of your data that's held by covered entities, which are generally healthcare providers, and health insurers and covered entity, or sorry, excuse me, business associates of those companies. So companies that have signed specific contracts and have to adhere to HIPAA as well. But when we're talking about smart cities and the growth of consumer devices in the health space, that consumer generated data, if it never enters the four walls of a healthcare provider, that is not covered by HIPAA. It might be covered by a state privacy law, but those, you know, your privacy protections, and this is why CTA advocates for a national privacy law, is because your privacy protection shouldn't vary by what state you live in. And so I think in order for consumers to trust these devices, there needs to be a strong national privacy law, and then also continued work, as I mentioned, in developing security standards and education for consumers around the cybersecurity of their connected devices.
Well, if no one else wants to weigh in, let's go ahead and have some closing thoughts just on your takeaways from the role of healthcare in smart cities, the role of broadband and technology connectivity. And let's just go in the same order we started. So, Julie, if you'd be willing to close us out, and then Catherine and Paul.
Yeah, as I said before, I have a lot of concerns about privacy and security. I think it is extremely challenging to meet consumers and patients who are fundamentally the owners of their health information in a place and with the right amount of information for them to understand what kind of data sharing will help them achieve an end versus what kind of data sharing may be for someone else's end, right? We know that we have a ubiquitous problem with organizations taking copies of patients' data and selling it for commercial purposes. I think in general, patients are not eager to do that. But it's very difficult to sort of look at a terms and conditions agreement and know how you could get the level of privacy and security you want. And once that data is out there, of course, it's out there. And so you can't control where it goes. So a lot of concerns about that. I think many organizations have been pushing the federal government to expand the scope of a HIPAA-like rule about privacy and security. Many other countries have, more robust protections for health data in all contexts than the U.S. does, which, to the point of Catherine, is limited to those healthcare entities that are covered.
Well, and thank you for being with us, Dr. Julia Scapik. Let's hear from you, Catherine. Any final thoughts you'd like to share with us?
I would just say I'm very excited about the growth and the potential of smart cities and healthcare. I will also mention CTA is ongoing work in the aging and technology space, and how technology can enable folks who are what used to be called aging in place, but I think now is more just just called smart cities and these other types of terms, but we're really excited about that. We continue to do consumer research around this space, so and continue to highlight the innovations at CES. So I encourage you to keep an eye on cta.tech. I put a link in the chat around all of our standards work. CTA has developed standards that on the health side, but also on the tech side that'll help enable these solutions. We actually developed the standard for airplane mode on your cell phone. So a lot of cool things to check out in the standards space there. So keep an eye out, and we look forward to continuing to work in this space and ensure that everybody has access to healthcare regardless of where they might live.
Okay, thank you very much, Catherine Pugh. Paul Villa, what are your final thoughts for us all?
Sure. So first of all, so obviously I've stated this many times, we're so grateful for being able to do what we can do due to Wi-Fi and due to broadband. Also the work that we do is applicable to the aging in place that Catherine had talked about. And, we hope that this also can move what we've learned from, because the physical challenges are very similar between the two age groups. We wish to move in that direction. And lastly, we want more. We want more companies to be involved in creating assistive technology. And it doesn't have to, it can be low tech. It can, LG just announced 3D printed accessories for their appliances. So people who have physical challenges can actually turn them on and do things like that. Tommy Hilfiger with his universal design has adaptive clothing that can be used for everybody. It's wonderful. Google has a project called the Euphonia Project, which is amazing, where you have a physically challenged person who can't understand their speech. They work with that program, work with that person, create a list of 2,500 words, and can create an algorithm that, as they're speaking, what they're saying is coming across their smartphone or smart device. It's truly amazing. So we want more companies to get on the assistive technology bandwagon so we can do more for our installed base of folks. And thank you very much, Drew, for having us.
That will have to be our last word. Thank you to each of our panelists, Dr. Julia Skapik, Catherine Pugh, and Paul Villa. On behalf of them, I'm Drew Clark, Broadband Breakfast, and we'll see you next Wednesday at 12 noon Eastern Time with a discussion about open access networks. Take care, everyone.